Imagine you're in a really crowded kitchen,
Mhm.
right? And suddenly, a massive grease fire just breaks out on the stove.
Oh, wow. Yeah, pure panic.
Exactly, total panic. And, the standard protocol you've been taught your whole life is basically to throw water on a fire.
Right.
So everyone in the room grabs their, half-empty glasses of drinking water
Mm-hmm.
and tosses them at the stove. But because it's a grease fire, the water doesn't actually put it out.
No, it just makes it explode.
Right. It causes the burning oil to splatter everywhere. It spreads the flames to the cabinets, and it makes the floor so dangerously slippery that people can't even, safely exit the room.
That is a perfect scenario of where our collective instinct to help or to just follow a deeply ingrained rule actually becomes the very mechanism that makes the disaster so much worse.
And that completely counterintuitive dynamic is exactly where we're starting today. Welcome to this deep dive.
Yeah.
We are unpacking a pretty dense and, frankly, highly unconventional stack of source material today.
Yes, very unconventional.
We've got books, clinical research papers, audio transcripts, all detailing the life's work of a veteran physician named Dr. KADIYALI SRIVATSA. And our mission for this deep dive is to explore a presentation outlining how an AI system named Dr. Maya can essentially create a world without dependency.
Which is a huge concept.
It really is.
Yeah.
The goal is to see how this system could dismantle our current fear-based healthcare institutions, help humanity reclaim its free will, and literally set people free from physical and mental illness. It's about boosting immunity and protecting ourselves from emerging and antimicrobial resistant infections.
Yeah, and it is a massive multi-layered thesis. But to really understand why a veteran physician with over 40 years of clinical experience would propose completely dismantling the traditional medical system, we kind of have to start with the physical threat that's driving his urgency.
Right, the backdrop to all this.
Exactly. The sources highlight this widely cited, very grim prediction. By the year 2050, antimicrobial resistance, or AMR, is projected to kill roughly 10 million people annually.
Wait, 10 million people a year.
A year?
Yes.
To put that in perspective for you listening, that would surpass the annual global death toll from cancer. I mean, we're talking about a fundamental breakdown of modern medicine here.
It's not just some distant sci-fi scenario. The materials frame this as an active, escalating crisis of both biology and human behavior.
So let's unpack the mechanics of this post-antibiotic era, because I think it's important to understand how we actually got here.
Yeah, definitely.
The materials point out that our so-called wonder drugs, starting with penicillin, are just failing. Bacteria like Staphylococcus aureus, which causes staph infections.
Right, they're adapting.
Exactly. They are evolving into superbugs like MRSA.
And it's really helpful to look at the biology of how that happens because, bacteria reproduce incredibly fast. And when they are exposed to an antibiotic, the ones with a natural genetic mutation that allows them to survive the drug, those are the only ones left standing.
The survival of the fittest on a microscopic level. Exactly. And then they multiply, passing on that resistant trait. But even more concerning, bacteria can engage in what's called horizontal gene transfer.
Which means what exactly?
It means they can literally pass the genetic blueprint for resistance to completely different species of bacteria that are nearby, like sharing a cheat code. And the sources argue this crisis is largely driven by our own systemic misuse of these drugs.
Right, the classic example being, a patient demanding antibiotics for a common viral cold.
Yes.
And the doctor just prescribes them to get the patient out of the office, even though we all know antibiotics do absolutely nothing against a virus.
Right. The patient feels like they've, quote unquote, done something to treat their illness. But biologically, they've just exposed their body's natural microbiome to a stressor.
Which just encourages any lingering bacteria to develop resistance.
Exactly. But Srivatsa's materials go even further. They point out the massive environmental impact. When millions of people take unnecessary antibiotics, those active compounds pass right through our bodies into the wastewater and out into the broader ecosystem.
Oh, wow. So
We are essentially bathing the environment in low-dose antibiotics. We're creating a global training ground for resistant superbugs.
Man, which brings us right back to that grease fire analogy from the start. Because Srivatsa makes a really highly controversial assertion here. He argues that our traditional doctor-centered healthcare model is fundamentally flawed when it comes to infectious diseases.
Yes, he does.
He suggests that the very act of going to the doctor actually makes pandemics worse.
And his reasoning for that is entirely logistical. Think about the standard protocol when you feel like a severe respiratory infection coming on. You leave your house, you travel on public transport or just through your community, and you walk into a clinic.
Right.
And then you sit in a crowded waiting room, usually a highly enclosed space with really poor ventilation.
Yeah.
And you're surrounded by other people whose immune systems are currently compromised.
So you basically have a room full of vulnerable people sitting right next to highly contagious people, all waiting an hour to see a doctor who, let's be honest, 9 times out of 10 is just going to say, it's a virus, get some rest, and drink fluids.
Exactly. You are spreading the grease fire.
But, okay, let me push back on this premise for a second, because I think anyone listening would naturally ask, wait, if I have a high fever and a terrible cough, aren't I supposed to seek professional help?
Sure, that's the reflex.
Right. Isn't staying home and just guessing what's wrong with me incredibly dangerous?
Well, that instinct to seek external validation is exactly what Srivatsa identifies as the core issue. In his framework, he calls it the culture of dependency.
The culture of dependency.
Yeah. His materials propose that over the last century, a fear industry has really developed around healthcare. The argument is that medical institutions, whether intentionally or just as a byproduct of a super litigious society, profit from a constant state of patient anxiety.
So patients are essentially conditioned to surrender their agency entirely.
Right. They don't trust their own bodies to handle a common cold, so they demand a pill. And doctors, who are terrified of malpractice lawsuits, engage in defensive medicine.
Meaning they order unnecessary tests and prescribe those unwarranted antibiotics just to cover their bases.
Exactly. And according to the texts, there is a tangible biological cost to living in that constant state of medical anxiety. It's not just some philosophical problem.
But it actually affects the body.
Deeply physiological, yeah. When a person is operating out of fear, the panic of getting sick, the anxiety of a diagnosis, their body enters a sympathetic nervous system state.
The classic fight or flight response.
Right. The brain floods the body with stress hormones like cortisol and adrenaline. And while that chemical cocktail is great for, running away from a predator...
It's not great for fighting off a cold.
No. Prolonged exposure to cortisol actively suppresses the production of white blood cells. So Srivatsa's underlying premise here is that the constant fear of illness, which is perpetuated by this dependent medical culture, literally weakens your true immunity.
Okay, so if the waiting rooms are functioning as these, superbug exchange centers, and chronic fear is actively suppressing our immune systems, what is the proposed solution?
Well, this is where the source material introduces MEWAY.
Right, which stands for Medical Advice USS.
Exactly. Dr. Srivatsa apparently took his decades of clinical experience, specifically his time working in intensive care units, observing all these complex physiological patterns, and he basically digitized his diagnostic intuition into an AI system.
And the core mechanism of Dr. Maya is a color-coded triage system, right?
Yes, and it's designed to be used by the patient in their own home. It empowers them to assess their symptoms before they ever step outside and risk spreading or catching an infection.
Let's break down those codes. There are 4 primary ones.
Right. So red indicates a genuine medical emergency where you absolutely must seek a doctor or go to a hospital. Green means the issue is minor. You're safe to just monitor it at home or maybe consult a nurse via telehealth. Yellow points to mild discomfort, suggesting maybe a conversation with a local pharmacist for over-the-counter relief.
And then there is the crucial 4th code, which is blue.
Yes, blue is the real pivot point for public health here. A blue code means the system has identified a high likelihood of a contagious infection or a public health risk.
So if you get a blue code, the immediate protocol is not to rush to a clinic.
No, you isolate at home immediately to protect the community.
Let's look at the mechanics of that, though, because I feel like this is where a lot of AI health tools just fall apart. How does an app sitting on my phone actually know if I have a highly contagious superbug or just, seasonal allergies if it can't physically take a swab from my throat?
It's a really valid question. But the materials explain that Dr. Maya is not structured like a standard, simple chatbot that just matches keywords to a database.
Right.
It utilizes an architecture called AI chaining to simulate what psychologists call System 2 thinking.
Oh, referencing Daniel Kahneman's framework. System 1 is our fast, instinctive, automatic brain. System 2 is the slow, deliberate, analytical brain.
Exactly. Most basic AI models operate a bit like System 1, They just predict the next most statistically likely word based on your prompt, which, can lead to hallucinations or really dangerous medical advice.
Yeah, we've all seen those AI fails online.
Right. But Maya's AI chaining forces a system 2 process. When you input symptoms, one AI agent acts as the data gatherer. It hands that data to a second agent, which generates potential diagnoses.
Okay.
Then a third agent acts as a challenger, or like a devil's advocate, looking for reasons those diagnoses might be wrong or dangerous. And a fourth agent might cross-reference your symptoms against real-time local epidemiological data.
Oh, so like analyzing whether there is a known outbreak of a specific bacterial infection right in your zip code.
Precisely. It forces the software to pause, debate with itself, and reflect before it ever gives you a color code. It simulates a doctor's internal diagnostic monologue.
That is a fascinating structural shift. We hear so much public anxiety right now about AI being used by corporations just to replace doctors entirely, usually just to maximize profit margins.
Well, constantly.
But this framework positions the AI not as a replacement for critical care, but as a protective gatekeeper. Its primary job is to keep people out of the hospital unless it's absolutely necessary.
Exactly.
Because if you keep the infected people isolated at home, you literally starve the superbugs of new hosts to jump to.
It creates a physical firewall. But to fully grasp Srivatsa's vision of this world without dependency, we have to look at the psychological bridge he builds between this technology and human behavior.
Right, because Maya isn't designed to just issue a command like stay home or go to the hospital, leave it at that.
No, not at all. The texts emphasize that it is programmed to explain the why behind the symptoms. It walks the patient through the biological logic of what their body is actually doing. And he argues that this transparency is what dismantles the authority trap.
The authority trap. Let's dig into that concept. The source material spends a lot of time analyzing how modern society essentially equates obedience with safety.
Yes.
We are culturally conditioned from childhood to trust the expert in the white coat, take the prescribed pill, don't ask too many questions, and you will be safe.
And Srivatsa contends that this authority trap is the very root of our medical dependency. When you constantly outsource your safety to an external institution, you stop listening to your own body. You lose your internal compass.
Yeah.
He uses the Sanskrit term swadharma, which roughly translates to one's inherent duty or self-sovereignty. His thesis is that the current medical paradigm, by demanding this blind obedience, effectively suffocates swadharma.
So you become a passive vessel just waiting for an authority to tell you how you feel, rather than being an active participant in your own biology. But again, I've got to play devil's advocate here. If we dismantle this reliance on experts, aren't we just inviting chaos? Like, how does a layperson who didn't spend 8 years in medical school and residency know what their body actually needs just by tuning in?
Well, that is the friction point where Srivatsa's work takes a really sharp turn from standard medical logistics into some very psycho-spiritual territory.
Yeah, I definitely noticed that shift in the readings.
He doesn't believe patients should just guess their diagnoses. I mean, that's what the AI is for. But he argues that true healing requires a fundamental shift in the patient's nervous system, a shift from fear to sovereignty.
Okay.
The texts outline what he calls a biological formula for healing. It goes like this. Safety leads to the heart opening, which leads to the brain aligning, which allows the body to heal.
So it's about actively shifting the body out of that cortisol-drenched sympathetic fight-or-flight state we talked about earlier.
Yes.
And moving it into a parasympathetic rest and digest state where cellular repair can actually happen.
Exactly. And the materials suggest a very specific, simple physical practice to trigger this cascade. The patient is instructed to place a hand on their stomach, take a deep breath, and say out loud, "I am safe to feel."
That phrasing is really specific. It's not an affirmation like, I am perfectly healthy or I am healed.
No, because if you are in severe pain and you tell your brain, "I am perfectly healthy," your brain knows you're lying.
Right. It's like, no, I'm not.
Exactly. And that creates cognitive dissonance, which just generates more stress. But saying "I am safe to feel" is different. It acknowledges the pain or the symptom without reacting to it with panic.
It's acceptance.
Right. It signals the vagus nerve to calm the nervous system down. Srivatsa calls this reactivating the spiritual immune system. It's about the patient reclaiming the driver's seat of their own biology before any external medicine is applied.
Okay, I follow the logic from antibiotic resistance to a digital triage app,
Hmm.
and even the psychological shift of reclaiming bodily autonomy to reduce stress, like that all tracks.
Yeah.
But reading through these materials, this is where the scope of the deep dive takes a massive, unexpected leap. Srivatsa moves from cellular biology and smartphone apps to planetary physics.
Yeah, it's a big jump.
The texts introduce concepts like color logic, measuring a patient's faith index, and then suddenly we're talking about the 3I ATLA's cosmic messenger and the collapse of the Earth's magnetic field. How on earth do we get from treating a cough to cosmic magnetic fields?
It is radical, but it is totally central to his holistic blueprint. Let's break it down sequentially.
Okay.
First, the AI integration. Maya doesn't just look at a list of symptoms. The texts state it integrates color logic, utilizing chromatic frequencies, and connects health data to the 5 elements and or prana.
Right.
It also attempts to measure what he calls a faith index, which the materials describe as a metric of heart-brain synchrony.
Wait, how does a software app measure heart-brain synchrony? Does it require like a smartwatch or external sensors?
Actually, the materials suggest it can be done using the smartphone's existing hardware. For example, modern smartphone cameras can detect microfluctuations in facial skin tone to accurately measure heart rate variability, or HRV.
Oh, wow. I didn't know that.
Yeah. And high HRV generally indicates a relaxed, coherent nervous system, while low HRV indicates stress. So the AI analyzes this data. If your biomarkers show a chaotic fear frequency, the system doesn't sound an alarm to panic you further.
It gently prompts you to pause, breathe, and remember that you have agency.
Exactly. It's trying to establish physical coherence in the individual.
Okay, but what about this 3I ATLAs in the magnetic field stuff?
Well, this is where Srivatsa connects the microcosm to the macrocosm. He posits that biological systems, human nervous systems, are deeply tethered to the Earth's electromagnetic environment.
This makes sense.
And it is a recognized geological fact that the Earth's magnetic shield fluctuates and weakens over time. Srivatsa builds on this by theorizing that as the magnetic field destabilizes, it induces physiological stress in biological organisms.
So the human mind becomes filled with the static of fear and anxiety.
Exactly. And the 3IATLAs is presented in the texts as a theoretical cosmic framework, or like a model, for understanding how this planetary environmental static interacts with human consciousness.
So his argument is that when the planetary environment gets chaotic, human institutions break down, panic sets in, and our free will basically gets buried under this heavy weight of external electromagnetic stress.
Yes. He views the human brain essentially as a biological antenna. It both receives and broadcasts frequencies.
Okay, so if we follow that premise to its logical conclusion, right now, if millions of people are walking around terrified of illness, terrified of superbugs, and totally dependent on a medical system that thrives on their anxiety, they are collectively broadcasting the chaotic static of fear.
Right.
That collective panic literally shakes the reality of our public health.
That is the philosophical crux of his presentation right there. The human mind is the ultimate battlefield for immunity.
But then, what happens if you introduce a tool like Dr. Maya into that chaotic global field? Like if you have a technology that sits on millions of phones, stabilizing that panic in real time.
Right, because it keeps contagious people at home.
Out of those fear-inducing hospital waiting rooms, it explains their biology to them and teaches them to self-regulate by saying, I am safe to feel.
Exactly. Under his framework, you are no longer just treating isolated infections. You are treating the collective field of human consciousness.
That is just a staggering implication to wrap my head around. If you accept his premise, Dr. Maya isn't just a triage app designed to save hospital beds. It is a coherence engine for the human race.
Yeah.
By systematically calming millions of individuals down and restoring their cognitive free will, it theoretically transforms humanity's collective electromagnetic static into a synchronized wave of peace.
It is a profoundly ambitious vision for a world without dependency. By removing the fear that feeds both the biological superbugs and the authoritative institutions, humanity reclaims its autonomy.
It's presented as a digital immune system for the planet, built fundamentally on that principle of swadharma.
Exactly.
Man, it has been a wild journey going through this material today. I mean, we started by looking at a very tangible physical threat, an impending era where antimicrobial resistance could cause 10 million deaths a year.
Which is terrifying.
Yeah. And we examined the argument that our current instinct to crowd into clinical waiting rooms is effectively throwing water on a grease fire.
And we explored his proposed logistical solution, which is an AI using System 2 chaining to act as a rational, highly cautious gatekeeper, keeping infected individuals isolated and safe at home without unnecessarily relying on lab swabs for initial triage.
But the deeper layer of this presentation, the really core takeaway, was the realization that, in Dr. Srivatsa's view, the ultimate form of immunity isn't going to be a new, stronger antibiotic pill.
No, it's not.
It is the act of reclaiming our free will. It's stepping out of the authority trap and recognizing that chronic fear is the biggest vulnerability our immune systems face.
The materials continually reinforce the idea that true hygiene does not begin with chemical bleach. It begins in thought.
Wow.
It culminates in compassion and is guided by principles like ahimsa, the ancient spiritual concept of nonviolence and non-domination. Srivatsa's message is clear. We cannot conquer nature with chemical warfare. We have to find a symbiotic relationship with it.
It is a framework that completely challenges how we view medicine, our relationship with technology, and really the power of our own nervous systems. Which leaves us with one final, lingering thought from Dr. Srivatsa's work for you to mull over. We discussed his theory that the human brain acts as a biological antenna, broadcasting a state of being that ripples out into the collective.
Right.
If you entertain that possibility, what frequency are you choosing to broadcast into the world right now? When faced with a crisis, are you adding to the static of fear and dependency? Or are you broadcasting the coherence of your own sovereign truth? Think about that the next time you feel a fever coming on. Do you panic and run to the crowd, or do you pause, take a breath, and listen to your own internal compass?